chapter, that is concept of health and disease, and that is very very important. Okay, so these all are the content that you have to study, and all among this 12 content, okay, among this almost so far you have been getting the questions from almost 10. Okay, all the 10 topics like concept of well-being have never been asked so far, but all the remaining topics, they have always been asked once or more in all your past questions. So this chapter is very very important. Okay, so do you all have books with you in your home?
Yes, ma'am.
Okay, so after I finish teaching you all, it'll be a good habit if you go through your books also, because I won't be providing the note for this chapter, because all the things are there in the book itself. Okay, so now let's begin. So first of all, let's begin from the definition of health. Okay, so I have been telling you in community, okay, definition is very very important. You all always get definitions, like you all appeared your formative exam last time, and you all might be knowing, right, that definition is very very important. So when you are asked define health, or you may even be asked in the viva also define health, then you have to say health is a state of complete physical, mental and social well-being, and not merely the absence of disease or infirmity. And in the past few decades, this definition has been supplemented by the ability to live a socially and economically productive life. So this second part, okay, this second sentence has been added now, because previously it was told that okay, physical, mental and social well-being is the health. Okay, but later on it has been told that you are healthy only if you are leading a social life, okay, so and you are living an economically productive life. So you cannot miss this second sentence also, so you have to give this complete definition. So, and there is something called positive health. Okay, so positive health means the perfect functioning of the body and the mind. So positive health does not mean only about your physical health. It does not mean that being disease free. Okay, so it considers the three basic aspects: the biological or the physical aspect, the psychological or your mind, and the social aspect. So biologically, health means the state in which your cell, your organ are functioning in the normal capacity. Whereas psychologically, the health is a state in which the individual feel a sense of perfect well-being and a mastery over his environment. Means if he is healthy in his mind, okay, so that is psychological health. If he is healthy in his body, then that is biological health. And if he is able to adapt himself to the society, to the people around him, then that is called the social health. Okay. And according to Dubos, the concept of perfect positive health cannot become a reality, because a man is never perfectly healthy, okay, because he is constantly struggling, because you cannot say that you are psychologically fit and fine, okay, because you are always surrounded by stress. There is always tension around you, okay, like now when you have the exams, then of course you are again having tensions in your mind, you are having the stress in your mind, and when your result comes, and again you will have a lot of tensions, right? So, and after you begin to work, and again now you'll have the stress to earn money, okay, to fulfill the need of your family. So the concept of perfect positive health is never a reality, okay, because the man is constantly he's always struggling, okay, he's always having the failure, he's always having the suffering. So there is nothing called perfect positive health. Okay, so positive health remain as a mirage. Everything in life is subject to change. Health in this context has been defined as the ability of an individual or social group to modify himself and itself continually in the face of changing condition of life. So since positive health, perfect positive health is not there, okay, so what is positive health means? It means the individual should have the ability to cope with all the struggles. If a person is able to cope with the situations and struggles in his life, okay, so that is called a health. So in the past also, okay, you have been asked to write the short note on positive health, and then you have to write all these things like what is positive health, and then about this. Okay, so if
Excuse me,
any,
ma'am.
okay, yes,
Ma'am, some of them are trying to join.
okay, I'll try, because I have to go back again. Only Shreya is there. Okay, do you all see the screen?
Yes, ma'am.
Okay, so now changing concept of health. Okay, so now as I told you, the definition of health itself is very important. You are asked many times in your exam. You can even note that. Okay, whatever I'm speaking, you can open your book and you can just tick those points over there. And then I told you about the positive health. Okay, so regarding the positive health, I think it's not given so much in book. I'll give you the note for that. And there is the changing concept of health. Okay, so now there are different things you might be confused. There is changing concept of health, and there is the changing concept of public health. Okay, so public health we will be studying in the next chapter, but you have to understand, if you are asked the changing concept of health, then you have to write these answers. Okay, so changing concept of health means, what was the concept of health among the people? Okay, so first of all, there was the biomedical concept. So people used to think that if you are disease free, if you do not have any disease, then you are considered to be healthy. Okay, so that was the biomedical concept. But there is a criticism, because it's not only your physical health that makes you healthy, right? Because there are the role of the environmental factor, the social factor, the psychological factor, and the cultural factor also, which affect your health. Okay, so it's not only having a disease-free state that makes you healthy. If you are psychologically, if you are mentally sick, if you are not able to adjust yourself in the society, or if you have many other imbalance between your health and the environment, okay, so then also you are not healthy. That's why this concept gained a large criticism, and this is not accepted. Okay, so after the biomedical concept, there came another concept that is called the ecological concept. So whenever the term ecology comes before you, you have to understand ecology means environment, right? So health is the dynamic equilibrium between man and his environment, and disease is the maladjustment of the human organism to the environment. Okay, so that means a person is said to be healthy if there is a balance between him and the environment, right? And whenever there is a lack of balance between the man and the environment, then the person is said to be unhealthy. Okay, like you can give the example, like whenever there is an air pollution, right? So the person also gets many respiratory diseases. So that is the ecological concept. So like if there is the water pollution, so the person can suffer from a lot of waterborne diseases because of that. So that's because of the lack of balance between the environment and the man. Okay, so those are the example of the ecological concepts. However, history argues that improvement in human adaptation to natural environment can lead to longer life expectancy and better quality of life, even in the absence of the modern health delivery system. Means, like when you give the example, okay, when you give the example of the rural life and the urban life, okay, in the present context, so who do you think are more healthy? Can anyone tell me? The people living in the rural areas, who are living there in the nature, okay, who are living there in the perfect nature, having a lot of greenery around them, who are eating the perfect organic food, and who are breathing in the fresh air, are they healthy? Or those people who are living in the urban area, who are always exposed to the air pollution, okay, and various other factors, the dust and all, okay, the industrial pollution, are they healthy? Can you tell me? Anyone, please respond.
Rural.
In rural area, right? So I'm just giving an example here. What I mean to say is that that is the role of the ecological concept, okay? Because when you go back in the history, okay, long back, the people used to be more healthier than those who are today, okay? Because although now we have the modern health delivery system, we have the good facilities, right? The health system, the medical system have improved a lot. Okay, so we have the recent different kind of machines with us, okay, to do the correct diagnosis, to do the different kind of treatment. We even have the treatment for the cancer or the various other diseases also that could be life-threatening if the modern health delivery system was not there. But when we compare today's life with the life before, okay, when we go back in the history, the people used to have longer life expectancy at that time, and they used to have better quality of life, all because there was a balance between the human being and their environment. Okay, so that's why this ecological concept is supported by this fact that even in the absence of the health delivery system also, if there is the good environment around us, if there is a balance between the human and the environment, then the person can be healthy. So other is the psychosocial concept. So we all know that health is not only being physically healthy, or not only the balance of the environment and the body, but also healthy means you have to be able to adjust in the society around you, right? If you when you go around, you have to adjust yourself with your friends, with the people around you, with your neighbor, right? You go to live in a new community, and then you don't talk to your neighbors, then you are not socially healthy, right? You should be able to adjust with the people over there. Or when you come to study over here for 5.5 years, okay, so you have to be able to adjust to all kind of people over here, all kind of friends over here, right? So that is the social health. And other is psychological health, psychological aspect. So psychological aspect means mentally healthy, means all the people have problems in their life, right? They face all kind of problem, but those people who are not psychologically healthy, who are not mentally healthy, they suffer from the depression, and they can have the suicidal tendency and all, right? But those who are psychologically healthy, they have the willpower, they have the strength to fight against those situations. So that is the psychological health. And other is cultural health, other is economical health and political health, okay? So those factors, if you are able to face those factors which are affecting those cultural factor, those economic factor, and those political factor which are affecting your health, then you are said to be the imperfect health, okay? So that is the psychosocial concept. And other is the holistic concept. So when you are combining the biomedical concept, okay, the ecological concept and the psychosocial concept together, so that is called the holistic concept. Holistic concept means you are considering all the above concept, okay? So it recognizes the strength of social, economic, political and environmental influences of health, implies that all sectors of society have an effect on health, especially agriculture, animal husbandry, food, industry, education, housing, public work, communication, and other sector. So when you see that all of these have equal effect on health, okay, like when you say agriculture, so how is agriculture important for your health? Because if the agriculture is not properly developed, then you won't have the proper crops, you won't have the proper vegetables to eat, right? So nutrition, that again will affect your nutritional status, and that will again affect your health. So that way agriculture is related. And when you talk about the animal husbandry, so again you need the nutritious food for you from the animal sources also. You need the milk, cheese, butter, milk, meat, okay? So these all are in the animal husbandry aspect. And then again, then you have the food, and then you have the industry, then you have the education, okay? See, these all factors also have got an equal effect on the health. So this is the holistic concept. So when you see here, okay, so there are basically 4 changing concept of health. When you will be asked in the exam, then you have to write about this 4 concept, okay? And these are very easy ones. So as we saw here, the first one, biomedical concept. So if you are disease free, then the person is said to be healthy. So that is the biomedical concept, but that is not true, so it was criticized. And other is the ecological concept, means when there is a balance between the man and his environment, that is called the ecological concept. And other is the psychosocial, when the social, psychological, cultural, economic, so these all factors are there, then that is the psychosocial concept. And when you are integrating all the 3 factors, okay, then that becomes a holistic concept, okay? So these all you have to write. And other is the dimensions of health. Again, this is also very, very important, okay? And there is another thing called determinant of health. So last time you all had been asked, your seniors had been asked about the determinant of health, okay? That was the question there in the final. So these dimension of health and determinant of health is again very, very important, okay? So you might be getting confused, okay? Because some terminology will be repeated there in the determinant of health also. So just understand, when you say dimensions of health, okay, so dimensions of health means what are the aspect of health. So there is the physical aspect of health, okay, there is the mental aspect of health, there is the social aspect of health, means when you are physically healthy, okay, when you are free from disease, you don't have any medical condition, then that is the physical dimension, okay? So when you are mentally free, you are able to cope around with all the problems around you, you are able to face all the problems around you, then that becomes a mental dimension. And when you are able to adjust yourself in the society, you are able to fulfill your role as a social person, then that becomes a social dimension, okay? So this way, those are the aspect or the dimensions of health. But when we say determinant of health, okay, determinant of health means what factors determine your health, so that becomes the determinant of health, Okay, so we will go one by one among all this. So first one is the physical dimension. So as I told you, when your body is fit and fine, okay, you don't have any medical condition, then that is the physical dimension of your health. Okay, so health is a state in which every cell, every tissue, every organ is functioning at optimum capacity and is in perfect harmony with the rest of your body. So there are many factors which will determine your health, right? Whenever you are taking the case history in the department, then you always take the vital, you take the pulse rate, you take the blood pressure, right? You take the respiratory rate. So why do you do that? Because you want to see whether the person is having the normal, all these values are normal or not. And if those values are not normal, then maybe the person is suffering from some kind of medical condition, right? So if you are physically healthy, like the physical dimension says that your organs should be of the normal size. Okay, all your sense organs should be intact. The resting blood pulse rate, the blood pressure, respiratory rate. Okay, so all of those should be normal. So normal is defined by the certain range. Okay, so that is determined according to the age and the sex. Like the hemoglobin level for the male and the female are different, right? And also the blood pressure is different according to the different age groups. So so according to the age and the sex, if you are having all those values in the normal range, then you are said to be physically healthy. Okay, so that is the physical dimension. So how do you evaluate your physical health? Okay, so first of all, self-assess your physical health. Because see, whenever you don't feel good, right? So you can assess yourself. You feel that your blood pressure has increased, then what happens? Then you might have some headache, or you might feel restless, right? So that is how you evaluate your overall health. Or maybe if you may be suffering from diabetes, then you may have the excessive thirst, okay, or you may be having excessive hunger, or you may having a weight loss. So that's how, because of the various symptoms, you will be assessing yourself overall health. And then you inquiry into the medication. Like if you see, even when you are taking the case history, there is a part in the medical history. You ask them about the different kind of diseases, and you also ask them about the various kind of medications they are taking. So based on the medications, then you can assess that they are suffering from a certain kind of disease or not. Okay, so a person's physical health can be evaluated by himself, the first thing. And second, you can inquire about the medications, and then you can know about their physical health, and then you can inquire about their level of activity. Because see, if a person is not healthy physically, then he'll not be able to carry out the work normally like before, right? So the level of activity can be inquired upon. Like if the person is having excessive pressure, then he will not be able to walk like before, and he will always try to take rest. Okay, so of course the level of activity will decrease. And then you can even do the clinical examination, or you can do the nutrition and the dietary assessment, or you can even do the laboratory investigation. So this is how the physical health is evaluated. Okay, and other is the mental dimension. So mental dimension means about the mental aspect of your health. Okay, so how do you know whether a man is mentally healthy or not? Because you cannot there is no any science, right? Like in case of the physical health, you could see the blood pressure, you could see the pulse rate, or other you could even do the laboratory examinations, and you could know whether the person is physically healthy or not. But when you come in the mental dimension, there is nothing that can there is no any examination. Okay, there is no clinical examination, or there is no any laboratory examination that can help you to know that whether a man is mentally healthy or not. So in that case, there are a set of questionnaires. Okay, there are various kind of questionnaire which will help to assess the mental status of a person, and that questionnaire are set by the trained interviewer, and you can ask those questions to the people, and based upon that you can know whether they are mentally healthy or not. Okay, so other is the social dimension. So social dimension include the level of social skill one possesses, social functioning, and ability to see oneself as a member of a larger society. Means you adapt yourself in the society. Okay, you are able to adjust yourself among all different kind of people. Then that becomes a social dimension. Okay, and other is the spiritual dimension. So spiritual is something related to yoga and meditation and all. Okay, so that gives you some kind of mental peace, right? So those are the spiritual dimension, in which like you do the meditation, you do the yoga, and you feel inner sense of calmness or inner sense of peace. So that is the spiritual dimension of health. And other is the emotional dimension. Okay, emotional dimension means feeling, it relates to the feeling. So you can have the positive feeling, or you can have the negative feeling. Okay, like the gratitude, showing the gratitude. Okay, showing the joy, showing the love, showing the care, showing the interest, having the good hope. Okay, so those are the positive aspect of the emotional dimension. Whereas if you are angry in a certain situation, you cry, you scold, you frown. Okay, so that becomes a negative aspect. And other is the vocational dimension. Vocation means job. Okay, so the physical work is associated with improving in the physical capacity. So see, now vocational dimension means whenever the person is not unemployed and he's having the job, then that becomes a vocational dimension. So in that case, okay, the person, when the person is vocationally healthy, then when he performs the work, then he is involved physically also and mentally also. See, because if physical work, and then that will help him in improving physical capacity, so that will help to improve his physical health, right? So now because of having the job, okay, so he will be having the mental peace, and that becomes a mental health. So now vocational dimension is affecting the physical dimension also, and also the psychological dimension, the mental dimension also. So vocation or work plays a role in both physical and mental health. Okay, and others, there are different other dimensions also. Okay, so you should know these names. So philosophical dimension, cultural dimension, sociocultural, socioeconomic dimension, environmental dimension, educational dimension, nutritional dimension, curative dimension, and preventive dimension. Okay, so there is something called a concept of well-being. Okay, so this though this has not been asked in the theory paper so far, but you may get the MCQs for that. Okay, so according to the psychologist, the well-being have objective component and the subjective component. Okay, objective component is what we see. Okay, so those are the objective component, what can be seen, like the standard of living, right? So if a person has like, let's say a person is living in a very good house, he has lots of money to spend. Okay, then he has enough money to feed his family, to give the proper education to his children. Okay, so those are there in the socioeconomic status, all of those are there. Okay, so that way objectively we can say that the person is having a good well-being. Okay, the person is having a good well-being. But now when you go in the subjective way, then there are many quality of life, like you can ask in the questions. Okay, the life is assessed by various questionnaires, so that becomes the subjective, because that the person will answer that. Okay, because see, objective part is what we see, the other people around him see. Okay, because of the he's having the proper housing, having the enough money, he's having the good life. Okay, so that others people see, that is the objective component, and subjective is what the person himself sees. So the standard of living, there is something called standard of living and the level of living. Okay, don't get confused here, both are the same, but you have to remember this point here. Okay, so because in case of the level of living, these 9 points has been given by the United Nations document, so you have to remember this. Whereas here in the standard of living, this has been given by World Health Organization. Okay, so that's why you have to remember this. All the points are almost similar. Okay, so when you say the standard of living, then it includes the level of education. Okay, so if you are highly educated, then it is said that you have a good, you have a high standard of living. If the person has employment, okay, he has got a good employment status, and he again afford the good food, good dress, he has a good housing, okay, and he has all the comforts of living in his house. He has the AC, he has the all the interior decorations, okay, that are important for the life. Okay, so then that is said to be that the person has a very good standard of living. Okay, and then other is the level of living, and again the same thing I repeated here. You can see the health, food consumption, education, occupation, housing, social security. Okay, so these all will determine your level of living. And there is something called quality of life, that is subjective component of the well-being. Okay, so even though the person may be having good housing, okay, he may be having all the money, he may be having all the necessities of his life, but what about his happiness, what about his satisfaction, right? The person might not be happy even though he has a lot of property, he has a lot of asset. So that is about the quality of life. Okay, so that is the subjective component. So even though he may have a good standard of living, or he may have a good level of living, okay, so his quality of life is not determined by that materialistic aspect. So that is determined by the happiness, satisfaction, and gratification. Okay, so this is the quality of life. So always the well-being is never determined by the standard of living alone. So the well-being is also determined not only by the materialistic aspect, but also by the satisfaction the person is having, the happiness the person is having by his life. Okay, so that is the concept of well-being. So there is something called physical quality of life index. Okay, so this is a composite indicator. So again, the word composite has come over here because when I taught you all about the classification of index, okay, so at that time also there was something called simple index and composite index, if you all remember. So composite means it is including more than one component. If there are more than one component, it is called the composite indicator. Okay, so here this physical quality of life index has three components. One is the infant mortality, other is life expectancy at age 1, and other is the literacy. So these three things you have to remember. Okay, so this is again important for the MCQ point of view, because you might be asked which of the following is not a component of physical quality of life index. So maybe I may shift the question and I may keep all these three options, and like I may ask you the infant mortality rate in one option, life expectancy at age 1 in another option, literacy in another option, then I may ask you life expectancy at birth. So at that time, what will be the fault answer over there? Correct answer will be life expectancy at birth, okay, because that is not in the physical quality of life index. So what is infant mortality? So you all might know this term, right? So number of death of children under age 1, because those children who have recently been born to the age 1, those are called the infant. So the number of death of children under age 1 as per 1000 live birth. So the formula will be number of death of children under 1 year of age, okay, divided by total number of live birth into 1000. So that is the infant mortality. So this will determine the physical quality of life index. And other is life expectancy at age 1. Okay, so what is life expectancy at age 1? Means normally, let's say currently the life expectancy in the present is, let's say, 70 years. Okay, so normally average number of people are dying at 70 years of age. That means life expectancy at age 1 will be 70 minus 1, that is 69 years. That means a child who is 1 year of age is expected to live for almost 69 years more. Okay, because in average, see, some people die even after 100. Some people die at 20, some people die at 30, some at 50. That's a general thing. But when we come in the general, when we talk about the average age at which a person is dying, okay, so that is the life expectancy. Okay, so normally most of the people are dying at 70. So for this person who is 1 year of age, so life expectancy would be 70 minus 1. And then literacy means a person is able to read and write or not. The formal schooling is not needed. Okay, it's not necessary that the person has to visit a school, but if he is able to read and write, then he's said to be literate. Okay, so these three factors will determine the physical quality of life index. So when you see here, the lowest score is 0, that is the worst, and the highest score is 100. And there is something called the Human Development Index. Okay, so again, this is important for the MCQ point of view. So composite index combining the indicator representing the 3 dimensions of human development to lead a long and healthy life. Okay, so here again, don't get confused here. In case of physical quality of life index, we had life expectancy at age 1, and here in the human development index, we have life expectancy at birth. Okay, so now when we talk about life expectancy of birth, then we have to see here a recently born child, okay, a newborn child, how long can he live? Means when in average the person are dying at age 70, so life expectancy at birth will be 70 years. Okay, so life expectancy at 1 year will be 70 minus 1. Life expectancy at 5 years will be 70 minus 5. But the person who is recently born, okay, this child who is recently born, for him, so we have to count 70 years. Okay. So other is there are also 3 factors here. This is also again a composite index, okay, because it is also including the 3 factors here. One is the life expectancy at birth, okay. So other is the education index. There's something called education index, which is seen by the mean year of schooling and expected year of schooling. Okay, so mean year of schooling, again here there are 2 things here. Okay, like let's say a person is 25 years of old. Okay, so for a 25 years of old, what is the expected years of schooling? Like in average, what is the education rate here in Nepal? Okay, so average people, how much they study? Maybe average number of people study the bachelor level, or they study the master's level. Okay, so that will be the, or maybe they study till class 10. So that is the expected year of schooling. Okay, so that was expected, but let's see how much this person has studied. So that will be the mean year of schooling. Okay, so according to that, the education index will be calculated, and there is something called gross national income. Okay, so that is the decent standard of living measured by gross national income per capita. Okay, so there is something called gross domestic product. Okay, so gross domestic product means the people who are living in Nepal, okay, how much they earn. That is called the gross domestic, because it is within the country. Okay, whereas national income, that will include the people who are living even abroad. They are Nepali. There are a lot of Nepali people out there. There are different kind of workers, okay, who are working outside Nepal. They are in Qatar, Dubai, Malaysia and all. Okay, but still they are Nepali and they are working there. So their income are also calculated in the gross national income. Okay, whereas in case of the gross domestic, only those people who are within the territory of Nepal. Okay, so understand that difference. So the value will range from 0 to 1. So when you see the difference here, in the physical quality of life index, the value range from 0 to 100, whereas in case of the human development index, the value range from 0 to 1. So if you Google human development index, okay, when you Google that, then you can see here that according to the 2019 report, the Nepal had the score of 0.579. So it's not so good also, it's not so bad also, right? Because it's somewhere in between, because the minimum score is 0 and the maximum score is 1. So we are somewhere in between, and our rank is 147 among all the country. Okay, so this is about the human development index. And again, I told you there is something called determinant of health. Okay, so these are the factors which will determine your health. So they are called the determinant of health. So there are the biological determinant. Okay, so biological determinant means your genetic, your gene, your age. Okay, these all things can affect your health, right? Like there can be, whenever there is a genetic abnormality, be the various chromosomal anomaly, okay, in the child who is going to be born, right? There can be the mental retardation, there can be various other diseases which are carried from the parent to the offspring. So that's why I see whenever you are taking the case history, so you take the medical history, right? So after taking the medical history, you also take the family history. So why do you want to ask about the family history? Because you want to know whether the patient, okay, the family, the parents of the patient were also having any kind of disease or not. So even though the patient at present might not be having that condition, but if his parents seem to have those medical conditions which are hereditary in nature, so there is a chance that this person can also have that conditions. Okay, so this is because of the biological, because of the hereditary property of the disease. So other is the behavioral and the sociocultural condition. So about the behavior means about your physical activity, about how you eat, okay, whether you sleep, you are having the enough sleep or not. So this is the behavioral condition. So in developing country like Nepal, where traditional lifestyle exists, the risks of illness and death are concerned with lack of sanitation, poor nutrition, enough sleep, and sufficient physical activity. So these are the behavioral factor which will affect your behavioral and sociocultural factor which will affect your health. Okay, and other factor which will affect your health, that is the environment. So again, environment, there are two things. One is the internal environment and one is the external environment. Okay, so whatever is around us, the air, water, soil, okay, the family structure. So whatever is there are the external environment, and whatever is within us, okay, our tissue, in our organ level, that is the internal environment. So environment also play a major role in the health. You all know that, right? Whenever there is air pollution, there is the water pollution, there is a noise pollution. So in all that cases, then you can have you can suffer from a lot of diseases. So that is how environment affect your health. So environment is also one of the determinant of the health, okay, one of the factor which affect your health. So other is the socioeconomic condition, that is the economic status. It determines the purchasing power, standard of living, family size, and the pattern of the disease. Okay, so whenever you talk about the socioeconomic condition, you have to understand three things. Okay, the economic status, the education, and the occupation. So now when you talk about the economic status, okay, if the person is wealthy, if he can afford all the aspect, okay, all the he can afford the proper diet, he can afford the proper nutrition, he can afford the proper health, he can go and afford the expensive hospitals, he can go and afford the expensive treatment. So in that way he might be comparatively healthy as compared to the one who cannot afford that, right? Whereas those people, okay, even though they can afford all the things, but they may be suffering from high rate of the coronary heart disease, diabetes, and obesity, which are seen in the upper socioeconomic group, okay, because of the lifestyle pattern. And other is the education. So again, education also has got a very important role on your health, okay, because see, whenever you are properly educated, then you may have a good attitude towards the various factors. Like if you are properly educated, then you will be more concerned about your health, your general health as well as your oral health. You'll be more concerned about brushing your tooth twice a day rather than those who are not educated, because they don't understand the importance of health, right? And also because if you are properly educated, then again you will have a lot of job opportunities, and that in that way you can be financially stable. So that is the education part. And other is the occupation. So again, occupation also has a great effect on your health, because if you have the good occupation, you earn enough, then again you can afford all the things that make you healthy. You can afford a good nutrition, you can afford to visit the hospital, you can afford the different treatment facility, okay. So that is, you can afford a good housing, you can buy sufficient good food, okay. So that is the occupation. Whereas occupation also affect your health negatively, because if you are working in a place, okay, where you are having the always you are having the stressful condition, you don't get the salary in time, you are always having the different kind of stress in your workplace, okay. So that will again cause your poor mental health. Or maybe if you are not having occupation at all and you are just staying idle at home, so at that time also you may be suffering, you may, especially the psychological aspect of your health, your mental health will be affected. And other is the health services, okay. So health services also affect your health. How? Because if you are having the accessibility to the health services, then you are particularly you are healthy. Whereas if you don't have the access to the health services, then you may suffer from a lot of diseases, right? Like let's say in the very remote area, okay, like because of the tough geographical condition, because of the lack of the proper road and lack of the proper vehicle, okay, there are many such remote areas in Nepal where there is not even a single health post. The people there have to walk a long distance, okay, to reach the health post, or to get access to the health facility. So at that way the health will be affected, okay. So the prevalence and incidence of the diseases will be increasing over there. And other is the aging of the population. So again, when and the number of elderly people will be more, okay, so again there will be more number of diseases, because whenever we get old, okay, so as we get old, so we are susceptible to develop a lot of diseases, a lot of, especially the chronic diseases like hypertension, diabetes, okay. So because of that, our age also has got a large effect on our health. And other is the gender, because again there are different okay, although it is the 21st century, okay, still there is a difference between the male and the female, okay. So far both are getting the good education, okay, there is no much difference, but still there are some areas where the male member, okay, they go to work, they go abroad, and the female are there in the villages, and they work whole day, okay. And especially in the kitchen, let's say in the first example you can see here, okay, she's working in the firewood kitchen. So in the long term she may be suffering from the respiratory disease here, because of this fuel, okay. A lot of carbon monoxide and carbon dioxide are generated here in such kind of kitchen, okay. So that will make her susceptible to the respiratory diseases as compared to the male, because the male will be having the masks, okay, to use the sanitizer. So these all, you to wash your hands, to maintain the proper social distancing, you all know that. But how do you know that? Because of the information technology. So everyone has a mobile, everyone has a mobile in their hand, right? So everyone has a Facebook now in the present day. And then there are a lot of news pages, okay, which come there. A lot of information, even the World Health Organization page is also there, UNICEF page is also there. So even our friend also share among ourselves, okay. So we get to know about the various things through the information and the communication technology. So let's say if the mobile technology was not there, let's say the internet, okay, the television was not there, then how would we face this pandemic now? Okay, a lot more people would be affected than those who are presently affected, right? So this is how these also affect your health. So let's end the topic for today here. Okay, Prasamsa, unmute yourself.